Welcome to My Generation, the podcast sponsored by South Shore Senior News. South Shore Senior News is both a magazine on a monthly basis, a website and portal for information, an ongoing e-newsletter, and other communications to help seniors navigate the unknown waters of being seniors for the first time, and also inform their caregivers and other senior professionals. Today, we have Michelle Woodbrey, who will be talking about the many choices of senior living and how to make that decision, and how you can get assistance with that decision and making the right decision. Michelle has been in the industry for over a decade, and helping people with various senior services. She's a graduate of Ithaca College with a BS and an MA from Prescott College. And with that illustrious introduction, I welcome you to the show, Michelle.
Thank you. Thanks for having me.
So the first question I think listeners have is, what brought you to this space? What brought you to this venture? And what is your passion that you bring to it?
That's a good question. I'd be happy to answer that. My sister and I, her name is Allison, and I grew up in the nursing home industry. Our father was the administrator of nursing homes, and our mother was a physical therapist that worked for him. And back then, it was more socially acceptable to date your boss. So we didn't go to daycare. Allison and I, we grew up in nursing homes, and that really impacted how we view ourselves in relation to the world and aging. So flash forward many years, she and I both worked in assisted living communities in various capacities, and many times at the same community. And we overlapped, and these were in states out west like Colorado and California. And we've, between the two of us, have done pretty much every job there is in assisted living except the nurse, the maintenance person, but we've definitely painted rooms and plunged toilets. We've done it all. And what we noticed time and time again is that people were telling us that they wished they had made this decision sooner. And we started to pay attention to why that is. What is it about this option that people really are glad that they embraced? And what are the reasons why they were hesitant to embrace it in the first place? So we really we're looking at that to try to help people. Our job, our objective is not to sell people on choosing assisted living or staying home. It's to present the information so people can make the most well-informed decision. And so we started our company. We're in our 14th year now. And so like I said, we were out in states in Western United States, and then our father was diagnosed with Parkinson's disease. And I knew that at that point I would be moving back to New Hampshire, to Massachusetts, to be closer to help my aging parents. And when I got here, I realized there were no referral services here in Massachusetts, services that are free or very low cost to the consumer, to help them really figure out what care options are going to be best for them based on their location preferences and their budget. So we were young and not married and didn't have kids, and we were, just naive or maybe idealistic enough to decide to start our own business. I convinced Allison to move back to the East Coast as well, and we started our service with the intention of helping people make the most well-informed decision. we do virtual care consultations where we take a look at what somebody's long-term goal is. I actually just got off a call with somebody who wants list of independent living communities in a certain area. And I can do that. We can provide a list, but I think that would be a disservice to the people that we work with, because it isn't just the independent living that they're looking for right now. I want them to take a look at, well, what happens if independent living doesn't work anymore? What are going to be your choices, and how does each of these choices affect your long-term plan financially and otherwise? So we do consultations focusing specifically on these care decisions, and how do you want to receive care, and where do you want to receive care, and how much does it cost, and all of that. So I hope that was a good enough answer.
It was very good. Thank you. And what point in time do people tend to contact you? Is it when there's been an incident and there's urgency? And maybe there's a combination of those who also plan far ahead.
Yeah, it is a combination. I would really like to say it's an equal combination, but it is not. As I'm sure you anticipated the answer, we have far more calls from adult children who are at a loss for how to help their parent now that a situation has occurred and they are not safe to be home by themselves anymore. That's the most common calls that we get. We do have people that are planning in advance, and I really enjoy working with people who do that, because we're able to open up a series of options for them in most cases that they weren't aware that they had. And if they weren't planning ahead the way they are, they wouldn't be able to take advantage of. And so it's an honor for me. My answer to your question is, when people come to seek information, it's too late. Always, call us sooner. Again, people are resistant, and what I hear most often is, well, I'm not ready for that yet. I'm not ready. And my question is, ready for what? For planning. And I get that. There's so many things in my own life that I know that I should be getting done. I have a young child, all these things, but it just isn't the biggest priority at the moment. So I don't get it taken care of. But I think the sooner that somebody engages with us, the better off they are. We are not going to convince somebody to move or anything else, but having the information sooner can only benefit you.
Okay. And so when you talk about I'm not ready yet, how do you help somebody make that shift so that they are on board with that transition, even if it's not a transition, even if it means getting more services, staying in the home? Sometimes people are even resistant to that caregiver. How do you sort of get them more open-minded about what is a changing landscape for them?
Yeah, I mean, that's a good question, and the answer varies based on who we're talking to. But one thing that we have learned over the years is that human beings are not going to make a major life change or a large purchase of any kind, and that this is both this type of decision, until the perceived value, what they think they're going to get, outweighs what they feel they're giving up. So it's a scale. And for most of us, we don't we have a hard time, if not a completely, it's impossible for us to anticipate the good things that are going to come out of something that we've never experienced before. That's just, it's not intuitive for us. And so it's like, do you want to stay in your comfort zone, or do you want to try this thing that, you can't possibly imagine? almost everybody is going to choose to stay where they are, what they know, that the devil, and it isn't until it seems like an option feels better than what you have right now that somebody will be open to making a change. And that happens in one of two ways. One, they find something that they feel actually will make their lives better. Maybe it's meeting a caregiver they really like, someone they get along with, and they could see being in their home with them and helping them out. That realizing that life could be better because you have this person helping you out, the perception of that outweighs the thought of just staying stagnant and being less than comfortable in your home. Or same with moving out into an assisted living community or something like that. You may find something. Some of these places, many of them, are just gorgeous nowadays, and the food is done by a 5-star chef, and you find something like that and you're like, I want that, and it seems more appealing than what you have going on. Or something happens, there's a crisis, and your health situation becomes untenable, and so then the perception of staying in that situation tilts the scale. But that really is what needs to happen. As an adult child, we can talk till we're blue in the face about that you should. I'm not a believer of shoulding on our parents or on ourselves for that matter, but helping people realize for themselves the value of what they will get if they make a change. Sometimes the only way to do that is like through a trial stay at an assisted living, for example. People don't realize that's something that you can do. And it's really effective because, again, we can say how nice it's going to be and you can do all these things, or you can have your privacy and all of that. But until they experience it, or I should say, once they experience it, the perceived value, no more selling is needed from the adult child in almost every circumstance. As soon as somebody goes into the right community, and everyone's transition period's a little bit different, but even for a trial stay, after a week or so, they can get a sense of how much easier life is, how much less anxiety, or how that they had anxiety they didn't even realize that they were feeling in their comfort zone. And with that alleviated, almost everybody in the 14 years that we've been doing this chooses to stay. They choose to stay because they have a higher quality of life, or life is easier, and it's less expensive. Even bringing care in before you really need it is in most cases going to save money in the long run. So sometimes people are motivated by the finances. Sometimes they're motivated by what they are not willing to accept about their changes. But having these conversations and framing it in the right way allows them to make these plans without feeling like I'm making my final decisions, and because that's really hard. And I think that's where so much of the resistance comes in.
Okay, and having helped my mother and my mother-in-law transition to assisted living, what I heard from them and from their peers was, I wish I had done this earlier. There was a transition period for me to get used to it, but now I am active and meeting new people and enjoying life more than I was previously. What is that transition period usually like, or how long would you say people report back to you about?
It varies a lot. In many of the scenarios where it goes well, it's just a matter of days. I mean, there's still a transition period for the person that moved. From where I sit and talking to the adult child, or even sometimes the senior themselves, really most of the time it's like, this is nice. I like it here. And that's almost the immediate reaction. If it's not, there may be some glitches, or there's no seamless transition, and people aren't necessarily clear on how to get any concerns that they have resolved. So they may give us a call, and we'll help them understand who they should speak with within the community to get their problems resolved. The one of the biggest pieces of advice that we give people is, don't look for a place or an agency that's perfect. You're never going to find it, and if you do find it, then you're probably looking at it with rose-colored glasses, because none of us are perfect. So what you want is to look for a place that, when something does happen, you feel is going to work with you to resolve it. And so doing a trial stay in assisted living gives them the opportunity to prove that. And the goal is to be responsive and to help people feel like their needs are being addressed, and this is better than being at home. What was your initial question? I don't think I answered that.
No, you did. You did. The
Okay.
original
Oh,
question
the
was,
transition period.
yeah, you did
Yeah.
very well. Yeah.
Yes. So
Yeah.
usually it's really short. Some people, if there's memory impairment, or some other circumstances, it can take a couple months, just to get into a pattern where their care needs are being met in exactly the right way. But yeah, ideally it's a really short amount of time.
And in terms of your geographic scope, some people want to age in the community that they're currently in. They want to stay in that familiarity. Some want to chase their children around the country. Some want to move with groups of other people that are friends. How far do you provide consultation?
That's a good question. The consultations that we offer aren't necessarily based on a specific geography. We can help people analyze the benefit or disadvantage to different geographical options. I had a woman I was speaking to earlier in the week, and she's contemplating staying here near her kids, or potentially moving to North Carolina near her sister. And there are a number of reasons why North Carolina seemed more appealing by the time we were done with the consultation. Not the least of which is it's a more effective financially. It's a more effective decision. But there was something about her when we talked about it, and when she talked about North Carolina, that she lit up. The idea of being near her sister and the social life that they could have there together. I could tell that that was something that she would really like. So we took that into consideration with the finances, and what it would take to switch doctors, and all of those things. And she didn't come up with an answer just yet, but she has some places in North Carolina. I put her in touch with a company that's similar to ours in North Carolina, to help her look at a couple of the independent living, assisted living options there. And we're offering her some options here near where she currently lives, where her son is. And then we can reconvene with her and help her weigh out which one. The truth is that as a younger, more independent person, I challenged her to not think about this as the last move she's going to have to make. It doesn't have to be a permanent decision. Maybe she moves to an independent living community now in Massachusetts near her son, and has plans to move to North Carolina when she starts to need some help. There's a number of ways to process this, but when we take the permanence off of it, if it doesn't work, we can change this. It makes it easier to move through this transition, and with less resistance as well. So that goes back to what we were talking about before too.
Okay. And so part of this process is to potentially, obviously, do a walkthrough, do a visit, do a tour, are there things that you recommend people ask and look for on that kind of visit?
Yeah. I recommend that you um, typically, and this is counterintuitive for most people, but my sister and I recommend that you don't bring a checklist or a list of questions that you feel that you need to get answered on the first tour. On the first visit, it is most important that you use your senses and your intuition and think, can I see myself here? Or can I see my loved one here? How does it feel? What vibe or what energy are the staff giving off? One of the basic rules of thumb is happy staff equals happy residents. If the staff are happy, the team members are happy in their job, they're going to do a good job taking care of the people who live there. And that's something that you can ask questions about, but it's really more something that you have to feel. Did they make eye contact with you when you're walking through the building? Do they say hi or stop to talk to you? Or do they just walk by and not notice you, not pay attention to you at all? How do you feel if after that first visit it seems like a place that you could see yourself at, and you've learned that it is financially viable for you? Don't go shopping for a Mercedes, for example, if that is not in your budget. But if you like it, then you'll go back and get all the answers to your questions that you need, or you can do that over the phone or work with a third party advisor like us. But you don't have to spend all your time and energy getting all your questions answered if it's a place that you don't really like in the first place. And so in terms of saving energy and really, I could talk to somebody who spent an hour and a half doing a tour, and they had a checklist, and then I'll ask them like, well, what did you like about the community? Could you see your mom there? And they can't really answer that because they were paying so much attention to getting the how much care do you provide, and what happens if we run out of money, and what is the annual increase percentage rate, and all of that. And it's all very important things to ask. But first, find communities that feel like ones that would be a good fit for you. um, and and then you can go back and visit, you can get your questions answered afterwards. People don't typically move into go somewhere and visit once and then move in or make a move-in decision. There's usually at least one or several subsequent calls and meetings and in-person visits. So that's our advice, is also have a pad of paper in your car. So as soon as you get out of the visit, write down your thoughts and questions. And I'm not kidding when I say before you even pull out of your parking spot, because as soon as you drive away, our brains do funny things, and we'll forget certain things and we'll latch on to other things, and it will be convoluted. But if you just jot down your notes before you drive away, then we can debrief that with you and pull out what questions you may want to ask or what concerns may pop up based on your specific situation. But yeah, put the checklist away and just go and see what you see.
Okay. And my last question is sort of one of the fastest growing segments of senior care is memory care. How does memory care differ from standard assisted living?
So the terminology that we use is traditional assisted living. So memory care and traditional assisted living. Most communities these days have both. So there's traditional assisted living, and then there's a memory care neighborhood. The terminology that we use is important. I think that's one of the things that I emphasize a lot. Let's stop calling assisted living facilities. They are not a facility, is a medical model of care, a hospital or a prison. It's not somewhere that we want to live. So an assisted living is a community or a residence. And a memory care within an assisted living is a neighborhood. So when we use the word unit, I haven't heard ward in a while, but those are referring to, again, a medical model. This is not. So it feels better to visit a neighborhood, to move into a neighborhood, to talk about a neighborhood with your loved one who you are considering having move in. Using the word facility or unit is immediately going to cause more resistance to whomever you're talking about. So memory care is there are many more, even just within the last few years, standalone memory care communities that are, and there's benefits and disadvantages of both for people, but it depends on the circumstance. Memory care is secure, which means you need a code or a fob to get in and out. So somebody who has memory impairment to the degree that they lack the safety awareness to go out of the neighborhood on their own, then they need to be in a secure memory care setting. And that's the key, is the safety awareness. If somebody lacks the safety awareness to be behind a closed door by themselves, and that means if they had a fall or if they had a problem, they would know how to call for help. If somebody can't do that, or we don't have confidence that they can do that, a memory care neighborhood is the most appropriate setting. I think that one of the biggest things I hear from people is, when will my mom or my dad need memory care? And my answer is often, your mom or dad will probably benefit from memory care well before they need to go in there. There's a lot of the programming, I want to say architectural, the interior design, everything in a memory care neighborhood is put there on purpose to help enhance the independence of somebody, the independence and quality of life for somebody who has cognitive decline. And being in the right level of care can have tremendous benefits. So somebody could be struggling some still in traditional assisted living. Many residents in traditional assisted living have memory impairment, but they aren't a risk to themselves. They aren't a safety. They don't lack the safety awareness that it's to the point where they need memory care. So the line is blurry. It depends on the community, but memory care is specifically designed neighborhood with programming for people who have significant memory impairment, that lacks safety awareness.
Okay, thank you. Well, we've come to the end of our time, but I'm sure that some of our audience would like to reach out to you for more insight into choices that are not easy to make. What's the best way for them to reach you?
Yeah, our website has all sorts of information and a description about what we do, and you can schedule a free introductory call right from the website, and then we can talk directly about what you have going on and make sure that we're the right resource, or put you in touch with the right resource. Our website is www.2sisters, which is the number 2 sisters dash SLA, as in Senior Living Advisor.com. So www.2sisters-SLA.com.
All right. Well, thank you very much, Michelle. This has been informative for me, and I hope it's informative for our audience as well. And we look forward to talking to you again down the road.
Thank you. I appreciate you having me.
All right. Take care.
Thanks. Bye.